Hello, welcome to Emmy. I'm here to help put you in control of your health. Before we begin, please be sure your sound is turned up, or turn on closed captioning if you prefer. Now, you're here to learn about injecting insulin. Okay, you probably have a few questions about insulin, so let's start with the most obvious. What is insulin, and why do I need to take it? Well, as you probably know by now, in the body, the food you eat gets broken down into a few different things, including glucose, which is a kind of sugar. And the sugar flows into the bloodstream, becoming blood sugar. Now, blood sugar levels go up and down all day based on a bunch of different things, like when and what you eat, which usually raises blood sugar, how you feel, like if you're sick or stressed out, which also drives up blood sugar, and how active you are. When you're more active, your blood sugar actually goes down. But what really brings blood sugar down is insulin, and the body usually makes insulin on its own. When blood sugar starts to go up, the body releases insulin, and this pushes the blood sugar back down. Now, that's what's supposed to happen. But if you have diabetes, when blood sugar goes up, it can stay high longer than it should. And over time, high blood sugar can take its toll on your body. It can lead to heart disease, vision problems, kidney disease, and nerve damage, like when people can't feel if they cut or injure their foot, which can be very dangerous. So the question is, what can you do to help prevent those problems and keep yourself healthy? Well, like you've heard a million times, eating right and being active are always good. And if you have type 1 diabetes, as you know, your body makes very little or no insulin, so you have to give it to yourself. With type 2 diabetes, the body may still make some insulin, so other medicines like metformin can sometimes help control blood sugar. But after a while, these may not be enough, so some people need to start taking insulin. This doesn't mean you're sicker. It's just how diabetes affects the body over time. And the thing is, along with diet and exercise, insulin is the most natural diabetes treatment there is. By injecting insulin, you're basically doing for your body what it can't do for itself. Now, there are many kinds of insulin, and some types work faster or last longer than others. These are rapid-acting, short-acting, intermediate-acting, long-acting, ultra-long-acting, and so on. And they all act differently. But to keep things simple, I'm going to divide them into two main types. Longer-acting, also called basal or background insulin, and short or rapid-acting, sometimes called bolus or mealtime insulin. Now, if you're taking insulin for type 2 diabetes, you'll likely start with basal insulin along with a medicine in pill form. But if you have type 1 diabetes, you'll likely use both kinds of insulin. So let's review how the two main types of insulin work together. As you know, when you have diabetes, your blood sugar goes up and stays high longer than it should. So longer-acting insulin is used to keep your blood sugar at a lower, healthier level all day long. You inject this less often, typically once or twice a day, at the same time every day. Now, some people need extra help around meal times since food raises blood sugar even more. That's where shorter-acting insulin comes in. Depending on the exact kind you use, you inject this anywhere from 5 to 30 minutes before a meal. To be safe, ask your doctor exactly when you should inject yours. And ask your doctor what you should do if you ever skip meals, because it's a good idea to have a plan for this, too. Also, all shorter-acting insulin lasts only a few hours, just long enough to bring your blood sugar down to a healthy level after you eat. So talk to your doctor about which kinds of insulin you should use and when. And now that you know what insulin does, let's go over what you use to inject it. But first, you may have noticed I've been referring to your doctor. Now, I realize you may get most of your care from your doctor, or it may be another member of your diabetes care team. But to keep things simple, I'll just say your doctor. Now, a lot of people worry about giving themselves insulin shots, but as you'll learn, the needle on an insulin syringe is really short. That's because this needle only goes into the layer right beneath your skin, where there are very few nerves. That means there's much less feeling there. In fact, a lot of people who inject insulin say they don't feel a thing, not even that little pinch doctors always promise. Okay, let's review the rest of the syringe, because there are some other things you need to know. First, there's the needle cap, which, as you can probably guess, covers the needle on the end of the syringe. Just so you know, most insulin syringes have orange needle caps. Where things get tricky is the lines on the side of the syringe. Of course, they help you tell how much is in the syringe. And since insulin injections are measured in things called units, the lines are known as unit markers. But only some of the unit markers are numbered. So what do the other lines mean? Well, that depends on the syringe. For example, on one type of syringe, each line may be 2 units. So the first line after the one marked 20 is 22 units. The line after that is 24 units, then 26, 28, and then 30 units. But there are also syringes that have markers for each unit or each half unit. Ask your doctor or pharmacist to help you pick the syringe that'll work best for you, and then have them show you how to use it with the exact amount of insulin you need to take. Okay, now you're ready to inject. We'll go over injecting with both a syringe and an insulin pen, but let's start with a syringe. And in addition to an insulin syringe, you need a sharps disposal container to throw the syringe away in when you're done, and your bottle of insulin, which is sometimes called a vial. Now, about storing insulin. Any insulin you have not started using needs to be refrigerated, but do not put it in the freezer. Keeping insulin in the freezer will ruin it. And once you start using a bottle, keep it at room temperature. Just keep it out of direct sunlight. But if you live somewhere that's above 80 degrees most of the time, you should keep insulin you've started in the refrigerator too. Just let it sit out for a few minutes to warm up before you use it. Injecting cold insulin can sting a little bit, and no matter where you keep your insulin, be sure to check the bottle's expiration date before you start using it. Here's why. Old insulin will not control your blood sugar well. And there are 2 ways to tell if insulin is old. First, there will be an expiration date printed on the bottle or on the box. This means the insulin will be good until that date if it is not opened and stored in the refrigerator. But once you open an insulin bottle, it may only be good for 28 days. Other types may have a shorter or longer expiration date. So ask your doctor or pharmacist how long your insulin lasts after it's opened, or check the information that came with the pen or bottle. And be sure to mark your insulin with the date you start using it so you can keep track. And check these dates each time you inject. If the insulin is old, get rid of the bottle, even if there's still some insulin in it, and start a new one. Okay, a few other things to check each time you inject. Look at the label to make sure you have the right kind of insulin for the injection you need to do. If you're not completely sure, talk to your doctor. Also, always check insulin for dark spots, crystals, or clumps. Insulin that's dark or has things floating in it does not work well. So if you see anything like that, throw the bottle out or take it back to your pharmacist, then start a new one. And just so you know, all shorter-acting insulin is clear, but some kinds of insulin are cloudy, and you have to mix cloudy insulin. To do this, roll the bottle back and forth between your palms for 20 seconds or so. But never shake insulin, cloudy or clear. Shaking insulin can make the insulin less effective. It can also create air bubbles, which makes it harder to get the correct dose. So again, roll it, don't shake it. And now that you've checked everything, let's go over an injection. To start, if you want to, wipe the insulin bottle's rubber top with an alcohol swab. Then take the caps off the ends of the syringe. First, take off the cap that covers the syringe's plunger, the end opposite the needle. Then carefully remove the needle cap. Now, this next step may seem a little strange, but you need to inject air into the insulin bottle. Why? Well, this actually makes it easier to get the insulin out. Make sure to ask your doctor what his or her specific instructions are for you, because they may be different. But you may be told that the amount of air you put into the bottle should equal the amount of insulin you need to take out. For example, if you need 14 units of insulin, you first need to inject 14 units of air into the bottle. To do this, pull back the plunger on the syringe until the bottom lines up with the 14-unit mark. The syringe now holds 14 units of air. Now, with the insulin bottle on a flat surface, stick the needle into the rubber top and push the air into the bottle. Now you're ready to pull insulin into the syringe. So, with the needle still in the bottle, turn it upside down. Now, slowly pull the plunger back. Just make sure the tip of the needle stays below the level of insulin in the bottle. To do this, you may need to pull the syringe out a little bit so the tip of the needle is lower. Keep pulling the plunger back until you have 14 units of insulin in the syringe. And if you pull too much insulin, just push some back into the bottle until you get the right amount. Next, with the needle still in the bottle, check the syringe for bubbles. If you see any, push the insulin back into the bottle. And pull another 14 units into the syringe, again checking for bubbles. Once you don't see any bubbles, and you have the right amount, keep the needle in the bottle as you flip it back over so it's right side up. Then, holding just the body of the syringe, not the plunger, pull the needle out of the bottle. Now you're ready to go. So, pick a spot at least 1 inch from your belly button, and at least an inch from where you last injected. Also, while it isn't necessary, feel free to clean the spot with an alcohol swab. But if you do this, let it dry for 30 seconds or so afterward. Next, you may need to pinch up a little skin if there's not much fat in the area. Now, hold the syringe like a dart and quickly pop the needle straight through the skin. If you just can't do it fast, slow is fine too. It just might sting a little more. But no matter how you do it, once you do it, push the plunger in, wait 5 or 6 seconds, and pull the needle straight out. If you bleed, put light pressure on the spot until it stops. Just be careful not to rub the spot. And you're done. So, put the syringe in the sharps container. Never reuse a syringe. It can hurt, and it's dangerous. Now, you can usually get sharps containers at a drugstore or a medical supply store. Some hospitals have programs that give them away for free. Depending on where you live, you might be able to use other types of hard plastic containers. But be sure to check what the rules are in your area first, because sometimes that isn't okay. And make sure you throw your needles out the right way, too, because most communities will not let you throw them away with the regular trash. So, to find out what to do with sharps containers and other home medical waste, talk to your healthcare provider or pharmacist, or contact your local public health department or waste management company. You can usually find them online or in the government section at the front of the white pages. Also, the hospitals that give out free sharps containers will usually take them back when they're full. All right, let's talk about the other way you can inject insulin. Using an insulin pen. Some people use a pen for all their injections. Others use both a vial and a pen, depending on what their doctor recommends. The pen comes with insulin in it. That means there's less to get ready before you inject. Now, there are a lot of different insulin pens out there, so I can't go over how to use all of them. But there are some things you need to do with any pen. First, check the label on the pen to make sure you have the right kind of insulin. You should also make sure the insulin isn't too old. It might be good for only 10 days after you first start using it, or it could be good much longer, depending on the type of insulin. And remember, if the insulin in the pen is cloudy, you'll need to mix it. To mix the pen, first remove the cap. Then hold the pen between your palms and roll it back and forth about 10 times. Then gently tip the pen up and down. First the bottom is down, then the top is down, and so on. You'll need to do this about 10 times as well, but ask your doctor if there are any specific instructions for your pen. You can also check the information that comes with the pen or ask your pharmacist. All right, then you need to attach a needle to the end of the pen. To do this, turn the needle clockwise like a toothpaste cap to twist on. Now, most insulin pen needles come with 2 caps. So first, take off the outer cap and hold on to it. You'll need it when you're done. Then take off the inner cap, covering the needle, and throw it away. Now, set the pen to give a very small amount of insulin, for example, 2 units. But don't inject this. Instead, point the needle up, tap the pen gently, and squirt the 2 units into the air. This is called priming the pen. It's to make sure everything works, so do it before each injection. If no insulin comes out, dial up another 2 units and prime the pen again. Once you know the pen works, set the amount of insulin you need to inject. Then inject it just like with a syringe. Find a good spot at least 1 inch from your belly button and 1 inch from your last injection. If you want, clean the spot and let it dry. Then push the needle straight in, and you may need to pinch up a little if there isn't a lot of fat in the area, or your doctor tells you to. Press the button on the end of the pen to push the insulin in. Ask your doctor how high you should count before pulling the needle straight out, but it's usually to something between 5 and 10 seconds. Again, if you bleed, just put light pressure on the spot until it stops, and be careful not to rub the spot. And put the outer cap back on the needle and twist the needle counterclockwise off the pen. If you're away from home and don't have a sharps container with you, put the capped needle in an empty prescription bottle or test strip bottle until you can throw it away in a sharps container. Once everything is safely stored, you're done until your next injection. And remember, you should use a new needle every time you inject, and your insulin pen shouldn't be shared even if you change the needle. Okay, speaking of that next injection, do not inject insulin into the same spot each time. I know it sounds strange, but it can cause hard lumps to grow under your skin. Aside from sometimes looking bad, these lumps don't absorb insulin well, and that makes it harder to control your blood sugar. But you can avoid this by changing where you inject, known as rotating injection sites. One way to do this is to move injections around in the shape of an M or W on one side of your belly. For example, if you think of an M shape, you'll have 2 points at the top and 3 at the bottom. So let's say your first injection in the morning is in the lower part of your belly, away from your belly button. This will be one bottom point of the M. Then your next injection is on a top point, and then a bottom point, and another top point, and so on. You don't have to be this exact. The key is to keep each injection at least 1 inch away from the last. This gives each spot time to heal between injections. Now, you can also rotate injections to other parts of your body, like the back of the upper arm, the outside of the thigh, or the top of the butt. Like the belly, these areas are less painful to inject into. But be sure to switch sides each time you inject. For example, if you give one injection in the back of your right arm, do the next one in the back of your left arm. Switching sides gives each arm time to heal, and the same goes for your thigh and butt. Just keep this in mind. If you rotate injections around your body, you may want to inject in the same area at the same time every day. This may help your body use insulin pretty much the same way from day to day. And that may prevent some ups and downs in your blood sugar. So let's say you decide to inject your morning insulin in your belly. You should do that injection there every day. Same deal with before lunch insulin in, say, the back of your arm. And bedtime insulin in your thigh. But of course you could inject in different areas around your belly too. These are just examples, but you get my drift. Same area, same time, every day. But before you try other injection sites, talk to your doctor. The two of you will work together to create the best plan for you. And that goes for everything about insulin treatment. You and your doctor need to work together. Chances are the first plan the two of you put together won't be perfect. You may need to change how much insulin you take and when. What works best will also change over time as your life and body change. So never be afraid to ask questions, especially when things don't seem to be working. It's really important to understand your care, because even though you'll have help, day to day, you're the one in charge.